All right, today we're going to dive into a pretty wild medical mystery. It's a story all about how one of our body's most essential building blocks can, well, basically turn against us and go totally rogue.
And it all kicks off with this simple, but honestly kind of terrifying question. What if a nutrient you need to live became a poison inside your own body?
Well, that exact question brings us to something called Wilson's disease. It's this rare genetic disorder where the body just loses the ability to handle copper. And it usually pops up when people are pretty young, somewhere between 3 and 20 years old.
Let's get into it. Part 1, a copper conundrum. This is all about how that essential element turns toxic inside the body. Okay, next up, the genetic glitch. We're going to trace this whole thing right back to the source. So here it is, the culprit. The entire problem starts with one single faulty gene. It's called ATP7B, and you'll find it on chromosome 13. See, this gene has a really important job. It's supposed to build a protein that acts like a copper transporter. And when that gene is broken, the whole system just collapses. And that one little glitch kicks off this disastrous chain reaction. So first, the body can't load copper onto its main transport protein, which is called ceruloplasmin. Then, because that's not working, the liver has no way to get rid of extra copper. It's kind of like the main drain in your body's plumbing system gets completely clogged. And you know what happens then, right? You get a nasty, toxic backup. Now, what's really interesting about this slide is the paradox it shows. You'd think, okay, copper overload, so total copper in the blood must be high, right? Nope! It's actually super low. And here's why. Most of your copper is supposed to be safely tied up or bound to that ceruloplasmin protein. When that process fails, the bound copper level totally tanks. But the dangerous, unbound, free copper? That stuff skyrockets. And that is the toxic copper that's causing all the damage. Okay, that brings us to our next section, the body's warning signs. So as all this toxic copper builds up, how does the body actually try to tell us something's wrong? Well, this disease really likes to attack two main places, the liver and the brain. You know, in younger folks, it often shows up first as liver problems. We're talking hepatitis or even cirrhosis. But for others, it hits the brain, causing all these neurological issues. The most common one, difficulty speaking, which is called dysarthria. Plus, you can see tremors and stiffness that honestly look a whole lot like Parkinson's disease. But get this, there's one super specific telltale clue, a real hallmark finding of the disease. They're called Kayser-Fleischer rings. And what they are is actual copper deposits that build up in the eye, creating this distinct greenish-brown ring right around the cornea. So, just how important is this clue? Check out this number. A whopping 95%, 95, of patients who have the neurological symptoms also have these rings. That is about as close to a definitive sign as you can get in medicine. And look, the damage doesn't just stop at the liver and brain. No way. This is a systemic problem, meaning it affects the whole body. That copper overload can mess with your kidneys, your pancreas, your red blood cells, even your hormones. It just causes this whole cascade of other issues. All right, next section, solving the medical mystery. Now that we have all these clues, let's see how doctors actually crack the case. So the investigation, it almost always kicks off with a really important blood test. Hey, remember that transport protein we were just talking about? Ceruloplasmin? The one that's supposed to be the safe taxi for copper? Well, the level of that protein in your blood becomes a huge piece of the puzzle. And here it is. This is the biochemical smoking gun. A serum ceruloplasmin level that drops below 10, that is a massive red flag. It's basically screaming that the body's copper transport system has failed, and it points right at a diagnosis of Wilson's disease. But okay, to be 100% sure, to get that final confirmation, the gold standard is a liver biopsy. What they do is take a tiny little piece of the liver tissue, and then they can literally measure the amount of copper that's built up inside. And that's the final undeniable proof. And that brings us to our final part, managing the overload. The mystery solved, so now what? How do we fix this? The main goal is pretty straightforward. You've got to get that toxic excess copper out of the body. And the way we do that is with special drugs called chelating agents, things like D-penicillamine. They basically grab onto the copper and help flush it out. Zinc is another cool strategy. It actually tells the body to lock up the copper so it can't cause any more trouble. But it's not always that simple. Treatment definitely has its challenges. That main drug, D-penicillamine can come with some really serious side effects. We're talking issues with muscles, kidneys, even the immune system. So it's absolutely crucial that patients are monitored super closely by their doctors.
So when you really step back and look at the whole picture, it's kind of mind-blowing, isn't it? It all starts with one tiny mistake in one single gene, and it just explodes into this complex, system-wide disease. It's just a crazy reminder of how fragile and delicate that chemical balance inside of us really is.
You know, for the longest time, Wilson's disease was a complete mystery. We had no idea what caused it. Then, we found that one little error in the genetic code, and it just makes you wonder, right? How many other secrets like this are still hiding in our genes, just waiting for us to find the right key to unlock them?